Now, my dear friend, in session 2, we are considering counseling, psychotherapy, sex therapy, sensate focus means same things. That is the foreplay techniques, pharmacotherapy, coital postures, what men and women want, personality evaluation and assignments. Session 3, masturbation. Always remember 96% males are masturbating worldwide and 76% women are masturbating. The masturbation is just like sexual act without lady. You explain to your client, male client, and it is very common. That doesn't reduce your energy or devitalize you. No, it is increasing your release your tension and stress and making you more perfect in the life. Homosexuality, we are going to see again. There are 80-20 laws of Paris law. 80% are the heterosexual, straight, and 20% of homosexuals, transgenders, gay, lesbian group, like that, gay, male to male, lesbian, female to female, like that. Oral and anal sex is very common. Those are homosexuals. Unconsummation is a married, but they can't have the intercourse. Such cases need first find out the conditions, whether it's an infection, bacterial infection, fungal infection, treat it first. Otherwise, it may be due to NEA course needed. What she needed is find out and admit her NEA. She's late. We can't help her now. If she's, though anyone, I make the host, please kindly admit her. I can't go from my slides. I have no time now. Now, my dear friend, that's why I'm telling you, at least log in 10 minutes before. I mentioned it, but nobody is doing. Anyway, unconsummation is over. You have to find out. I forget again. Anyway, vaginismus. Vaginismus is a psychological condition where the female contract their vaginal muscles, nearby muscles, perineal muscles, so that they are not allowing the touch of the finger, how they will allow penile shaft, because maybe due to psychological problem or some may use, abuse, whatever the things in their past life. You have to take care under counseling. Now, my dear friend, sex factors is very important. We are going to see male infertility also point of view. We are going to see all these things. Other session 4, we have seen all these things is over. All had conducted number of times. Nobody is attending. Somebody attending sometimes. Somebody attending once in a month. I'm doing my job sincerely. Every week I appear, but your duty to learn. If you have any problem, then again you can contact me during my hours, clinic hours, 12 to 6. I'm free to concern any problem regarding you had in your clinic. Female sexual arousal disorder, frigidity, female orgasmic disorder. Sometimes female need more and more sex. That is a nymphomania. Sometimes they have frigid totally. You have to see. Dyspareunia, painful coitus, treat with antibiotics and antifungal treatment. Sexuality in aging, as the age advances, testosterone reduces in the male, but they can perform. If they reverse their remission of their asthma, diabetes, blood pressure, hypertension, because they are all interlinked, metabolic disorder. Sex in some common condition, premature ejaculation, all we have, and sex education and sharing with you. Now, my dear friend, I'm not taking much time. Your diet prescription, I have shown you overweight causing low libido. Steps for good health, step for physics, stamina. I'm not taking much time here again. Vacuum erection device is a very used only 2 to 3 minutes twice a day or thrice a day, but not more than 10 minutes in continuous or in one sitting. Only for 2 to 3 minutes you advise your client. I will give the indication and contraindication shockwave therapy. You can advise each and every patient about 25, 35, 40, 50. Middle age group is more effective and they are very happy. Not in one shockwave therapy, you have to repeat minimum 4 to 5 sessions. Then the patient says their early morning erection is increased. That was not in previously. That means it's improving well. And this is the way what shockwave therapy helps. And need the less oral therapy like 5-phosphodiesterase like sildenafil, tadalafil, vardenafil, and number of things are there available in market. Now, vaginal tightening is also one need in your sexual clinic, particularly tightening the vaginal muscles to get more enjoyment to your male partner. Sometimes such a complaint about the male coming to us. Then erotic zone stimulation is very common, very important. You should know. What is the erotic zones? Ear is the erotic zones because ear representing whole body. Then nose is the erotic zones. Touch the nose, get the excitement. Lips are erotic zone much more. And other things you know more, know well, breast and chest and all other, or any part of the body, but these are the more things. Use of papaverine injection available by mix, trimix, use very cautiously, a very small dose. Make 1 ml into 4 to 5 syringes of insulin syringes. Use one because half hour is more than sufficient for keep the erection penile soft. If you can't place it within 3 hours, then it may reach to the priapism and need the decompression or need the penile prosthesis. So be careful or remove the blood and then again it becomes flaccid. So always the patient should be under your custody for when you are using papaverine injection. Otherwise it comes under the medical legal condition. Even still today, for diagnosis of impotency,